Okay, thanks so much for dialing in this morning and participating in our Prince George's COVID-19 vaccine update call with County Executive Alsobrooks and administration leaders. My name is David Sloan from the Office of the County Executive, and we're so thankful that you made time for us today for this update and conversation on the county's efforts to deploy vaccine. As always, we have a very thoughtful agenda. You'll hear from the County Executive and the County Council Chair, and you'll also hear from our Chief Health Officer, Dr. Ernest Carter, our Director of Homeland Security, Ronald Gill, and Director of the Office of Community Relations, Yanisha Davis, who are all here for our Q&A section. And we'll have the opportunity to address questions submitted by Prince Georgians from all across the county and from some residents who are live here with us. Since taking office, the County Executive has been committed to communicating honestly and thoroughly with you and our entire Prince George's family. Today will be no different. Additionally, in the midst of this pandemic, she has empowered your government to act with compassion, emphasizing policymaking that's thoughtful and always focused on preserving the lives of Prince George's. Please welcome our County Executive, the Honorable Angela Alsobrooks.
Good morning, everyone. I first want to start by saying thank you to you, David, for helping us to facilitate today's call. And then I want to thank all Prince Georgians for joining us for this Tele-Town Hall as we share the latest updates on our COVID-19 vaccination efforts. I am so grateful to be with all of you today and hope that we are able not only to answer some of your questions, but alleviate your concerns about the various aspects of our vaccination rollout. As we move our vaccination efforts forward, we will continue to focus our limited number of vaccine doses on high-risk residents. And I want you to know that we have done a great deal of work since the beginning of this vaccination process, and I believe that we are in excellent position to quickly vaccinate Prince Georgians once we receive additional supplies of the COVID-19 vaccine. Now, before I go on and talk more about the vaccine, I want to remind everyone that we are still at the beginning of our vaccination process. And what this means is as we begin to administer these vaccines, we want you to know that the best way to stop the spread of COVID-19 is still to wear a mask. Please to still wash and sanitize your hands. We want you to practice social distancing and to limit travel to essential trips only. I also need to remind you, and I'm sure Dr. Carter will say it, even as you have received, for example, your first dose, there is still a window during which time you can still get the COVID-19 virus, and so you have to still be very careful. Now, I want to start by taking a moment to address our residents who have pre-registered to receive the COVID-19 vaccine. I've received your calls, I've received your emails, I have heard your concerns and your frustrations. You should know, of course, that I take all of them to heart, and I know that there have been many, many frustrations in this rollout, and I have to tell you, for those who have been inconvenienced, or otherwise who have experienced various frustrations, I do want to apologize to you and to ask you to continue to work with us. We are working very diligently to make sure that our operation is not only efficient, but it is professional and compassionate. Now, we have faced some challenges with issuing vaccination appointments. This is an open secret, and that is sometimes due to things that were unfortunately out of our control. But I am now happy to say that we have come up with a solution to address several of the issues that we have experienced. Many people, for example, received a first dose, but were unable to make a second dose appointment. I want to talk to you a bit about how this happened. Many of you were given a piece of paper at the time of your first appointment. That piece of paper had a QR code or a link for you to visit. However, when you visited that site to make your second appointment, to your dismay, you discovered that all of the appointments were taken. This was because the personal link that we provided to individuals to make a second appointment, unfortunately, was shared widely. This meant that some of our residents shared this link with their friends, family, and neighbors, and those individuals made appointments and took all of the slots that were available for those who needed them for their second shot. We have a solution to that going forward. We ask, of course, that anyone who has a link to please use integrity and not share that link. It does complicate it for us and does cause, of course, an unfair result. But what we know now is that if you had a first dose, and so there's a universe of individuals who had a first dose, but who were unable to schedule a second dose at the time of your appointment. I want to talk to those people now. If you received your first dose, but you were unable to schedule the second dose at the time of your appointment, you should know you will be contacted by the health department. They are tracking second doses and will follow up with you a week prior to your second dose appointment to provide you the link to schedule that appointment. And this means that making your appointment for a second dose will not be an issue going forward. The people who had the first dose look to be contacted if you're still waiting. But I want you to know also that as of this past Monday, we have staff now at our vaccination sites who will be able to make your appointment for a second dose before you leave. So this means at the time of your first dose, you will leave that facility with your second dose appointment already made. I also want to touch on another issue, and that is that the website and that is regarding the website for scheduling appointments. Initially, Prince George's County relied on the state vaccination website. It's called PrepMod, for our appointments here in Prince George's County. This has been a tremendous learning process for us, and what we have found is that the state registration site is very, very difficult to navigate and has created tremendous problems for all of us. So in addition to sending unsecured links, we've learned that that particular site crashes. It has created other issues for our clinicians and our residents. And so we are working with the state to make sure that they are aware of these issues. And they have already started working to correct some of the issues that we have brought to their attention. But that PrepMod site that has been used is a state site. That's what you should know. It is not a county site. The state vaccination the vaccination website is a state-operated site, and we've been working within that framework to schedule appointments, and it has been a disaster for us to deal with that site. Right now, our Office of Information Technology is working with our health department to build a more functional and user-friendly site for appointments. And we will have that site. It'll take us a little while to build that site. But in the meanwhile, we are switching to the health department's electronic record systems to make appointments. And this will help us to address multiple problems that we have experienced with the state registration site. For Prince Georgians who are eligible to receive the vaccine now, I want to cover the status of our pre-registration list. At present, you should know that we have more than 100,000 people pre-registered for the vaccine. In the neighborhood, probably more like 125,000 people who are already pre-registered for the vaccine. We're still working to vaccinate individuals in phase 1A, and there are currently more than 26,000 people on our waiting list in phase 1B that need appointments as well. Many of our residents pre-registered in January and have still not received appointments. As Dr. Carter and I have said before, this is due to the limited number of supply, and so it will take us some time to work through our pre-registration list. We understand that this has created tremendous frustration for you and for us, that we have so many people who are on that list, and I'm going to tell you in a second what we are going to do. We're switching now from the state vaccination registration system, as I explained to you, to the health department electronic record system. And this will allow us to begin scheduling appointments further in advance. So we are not going to wait, as I told you, but 125,000 people who are waiting, and we receive, to this point, we've only been guaranteed to receive 975 doses of the vaccine per week. That's what the state has guaranteed us, 975 doses of the vaccine per week. So with 125,000 people, we were hesitant to just go ahead and schedule them, but we are now going to schedule appointments further in advance because our system is ready to receive it. And so we'll be utilizing it beginning this upcoming week. So by the end of this next week, those on our pre-registration list who have been waiting will begin to receive their appointments. And what we've decided, we're prioritizing still phases 1A and 1B first, but those who are in 1C should also begin to receive appointments as well. We anticipate that we'll be able to schedule everyone in 1A and 1B and begin scheduling individuals in 1-2 within a couple of weeks. And so, again, to be clear, by the end of this upcoming week, we'll see those appointments will start filling up. But it will take us a couple of weeks for us to schedule everyone who's eligible in 1A and 1B. So if you do not immediately receive your appointment this week, or at the beginning of the next week, do not worry. I promise we will get to you. And as we move into this new system, we also want to take the guesswork out of the appointments process. So you will receive separate appointments for your first and second dose at the same time. So as you begin to receive those appointments that we're going to start sending you, you don't have to worry anymore about when you'll get your second dose appointment, because you will receive the appointment for both your first dose and your second dose at the same time. Now, unlike the state site, the other thing we're doing is making sure that this time you will not be provided a link to select a date and time. Instead, you will be given both appointment dates with times and locations, which will resolve the issues that you've seen with scheduling second dose appointments, and it will also resolve the issue of individuals who are sharing links with family and friends who are not eligible. So we are asking that you please be flexible when you receive that appointment time, because we don't want to waste the time and risk having people have difficulty trying to navigate the site, because we're working a lot with our seniors, some of whom are not as comfortable with technology. So rather than have you deal with the frustration of trying to get in and navigate the site to make the appointment, what we've decided is more expeditious is just to send you the appointment date and time to assign it to you. So we're asking that you be flexible, please, to make sure that you are able to be ready for those appointment times. And I encourage all of our residents to pre-register still for the vaccine. Our goal is to vaccinate 728,050 eligible residents in Prince George's County. And so if you have not done so, please pre-register as soon as you can, because this is how we will be issuing those appointments. This way we can help you schedule an appointment when the time comes and provide you also with regular updates on our progress delivering this vaccine. So you can pre-register at mypgc.us/COVID vaccine. Again, that's mypgc.us/COVID vaccine. Now, I want to talk to you a little bit about vaccine availability. This topic, of course, again, is an open secret. Everyone across the country knows that vaccine supply is our primary challenge right now. And initially, because our vaccine supply is no different than the challenges we've seen not only across the state but across the country. And as I indicated to you a moment ago, the number of doses that we were initially guaranteed to receive from the state was 975 first doses. We are pleased to report, and this has been a relief for us, that as a result of much advocacy, and we want to thank many of you for this as well, we are told now that the number will go up to 4,200 doses that we in the county can expect to receive for at least the next 2 weeks and perhaps the next 4 weeks. This is good news for us. We know that as the federal government works to increase vaccine production, the pipeline will also increase. And so right now, the vaccine supply is still very limited. Remembering that I told you, of course, we have already 125,000 people on our waiting list, and we've been guaranteed now that we'll receive 4,200 doses per week. And so we'll start working down that list, but that just gives you some indication about the issue regarding the supply. Now, what our supply challenge means for us is, even though we're going to schedule those appointments, we're going to schedule them into March and into April. So you'll receive appointment times that will stretch into April, given the large number of people we have to vaccinate. What this means is that because we are relying on the state to receive the vaccine supply, we cannot create the vaccine supply here. We can just rely on the state and federal government to get it to us. But this means that there may come a time when we're required to cancel appointments because there's not enough vaccine on a given day. We just want to be transparent with you about that this is one of the challenges that we could face. We hope it doesn't happen, but I want you to know that there's a possibility that it could. And if our supply limits cause us to have to cancel appointments, you should know that we will reschedule those appointments as soon as our supply is replenished. So we'll be ever watching out for it. And if this becomes a problem and we have to cancel appointments because we don't have vaccine on that day, we will simply reschedule those appointments as soon as possible and get them out to you. Now, it is paramount that as more vaccine becomes available, we also will have the capacity needed to deliver the vaccine to our residents quickly. And that's why we continue to expand our capacity and our infrastructure here in Prince George's County. Currently, we are able to deliver 1,600 doses of COVID-19 vaccine each day through our health department's clinics. We currently have 3 facilities operating under the purview of the county health department, one in Cheverly, another at the Sports and Learning Complex, and the last at the Southern Regional Technology and Recreation Complex. We will have a soft launch of a 4th facility at the Laurel Beltsville Senior Center next week on Wednesday, or this week actually on Wednesday. And with that site, our vaccination capacity will increase to 1,900 doses per day. And that's just through our county health department. We have provided over 12,000 first doses of COVID-19 vaccine during the month of January. And that means that we have 12,000 second doses due during the month of February. And our second dose appointments from January are beginning this week, and we'll continue to ramp up through the end of the month. And so we're continuing to provide both first dose appointments, including 2,000 that we administered this week alone. And since those vaccines require 2 doses to provide protection, our priority must be ensuring that with first doses, that those who receive first doses also receive their second dose at the appropriate time. And because this vaccine also requires 2 doses, eligible residents have found themselves sometimes on the pre-registration list with no appointment for a vaccine because we've had to make sure that we've had the dose also for those second doses. Now, again, that will change as we move away from using the state site and begin to schedule appointments for eligible individuals into March and into April. Additionally, you should know that because we're expanding our ability to administer the vaccine, we have 3 mobile vaccination units, which are capable of handling 50 appointments per day. So that's another 150 appointments per day with the 3 mobile units. We will use them to target eligible people who are in hard-to-reach populations. We completed a test of our mobile vaccination unit on a small scale where we successfully provided vaccinations at a domestic violence shelter, and we're working to ramp up this program so that we can reach more Prince Georgians. Our county health department will deploy the mobile vaccination units all around the county. One of these units will partner with Casa de Maryland to vaccinate eligible residents in our Latino community. We also will be doing pop-ups at churches to get to our broader community. We will rely on data from our COVID-19 numbers as well as our pre-registration list to determine where we will send those mobile units to ensure we are distributing vaccines equitably across the county to those who need it most. Our county health department continues to go above and beyond to expand capacity for this unprecedented vaccination effort, and we're glad that we have additional resources as we have collaborated with our medical partners, including Luminous, who is assisting us with vaccinating staff at dialysis centers, and working with the Department of Family Services to provide vaccinations at our senior living complexes. We're also working with the University of Maryland Capital Region Health, which is vaccinating our health care providers in our county. MedStar has accepted seniors 75 and older from the county health department's pre-registration list for vaccine appointments. Giant Food is also working with us with the Department of Family Services to provide vaccinations at senior living complexes. And Kaiser Permanente is assisting with vaccinating Prince George's County public school employees. So in addition to these sites, the state opened Six Flags, and we will continue to ensure that our residents have equitable access to that site. In addition to state and federal pharmacy partnerships, we've been talking to the state to make sure that there are appointments set aside for Prince George's, but that is a state-operated site, and we are working with them. We want to make sure that what happens there is equitable. I want to remind residents that our vaccine pre-registration supplied by the county health department does not automatically register you for all of the available vaccination programs. And I know this is a question that many have had. So, for example, your question may be, does that pre-registration also consider Giant? Does it also consider some of the other locations around the county that are operating to vaccinate? And unfortunately, it does not. So we encourage all residents to fill out our Prince George's County pre-registration form, and we also encourage you to sign up for other opportunities to receive the vaccine as well. Now, I know what you're thinking, the same thing we're thinking. Why wouldn't pre-registration with the county automatically sign you up for all of the available vaccination programs? We agree with you. The state of Maryland is providing vaccines to many different entities, and each available program requires an additional sign-up. So at this time, signing up with each option increases your chances of getting a vaccine appointment. This is something that is out of our control. We do not control how the state allocates those vaccines to the different entities and do not control as well the sign-up for those entities outside the health department. So our capacity to deliver the vaccine right now, you should know, is greater than the supply we're receiving. So in other words, we have the infrastructure to administer the vaccine, but as we receive more doses of the vaccine in the near future, then we'll be able to deliver more vaccine and for all Prince Georgians. So before I close, I also want to take a moment to address a topic that I've heard a lot about, and that is about Prince George's County vaccine being received by people who are outside of our county, outside residents. And it is of concern to many, whether out-of-county residents who don't work in Prince George's County received an appointment at our sports and learning site for a vaccine. And it's important to address this because you know how this goes. The bad news travels faster and information that is not accurate travels more quickly than accurate information. So you heard it here from me. When vaccinations open to phase 1B, you should know that the initial guidance that our health department received from the state said that counties could not restrict vaccinations to just their residents. So we were trying to be compliant. The state opened up the site and said that prep mod site that they have had to receive registrations from people. We couldn't restrict it. The state then quickly reversed itself and said that, local jurisdictions could restrict it to their residents. And so we had to quickly correct course. So our health department staff went through and manually canceled thousands of appointments of those who neither live nor work in Prince George's County. And again, this is because the initial instructions we were given from the state said we couldn't restrict the vaccines to people who just lived here. And then quickly reversed itself and said, oh no, we want the locals to make a decision. And this meant that there were 2 days where those appointments started to fill up with people who didn't live in the county. Now, I heard from the questions and concerns from people who believed that what happened was thousands. I've heard over and over again that hundreds or thousands of appointments went to residents of other jurisdictions. And what I want you to know is that did not occur. That did not occur. During the week of January 18th, we only had 2 full days of vaccinations at the Sports and Learning Complex due to the holidays. So on January 21st and 22nd, we provided 1,726 vaccinations. Of those, 965 or 56% went to Prince George's. And the reason is because, remember, in 1A, we were vaccinating people mostly based on their job. We were doing the frontline workers and others. So during those 2 days, we provided 423 vaccinations to residents 75 and older. So most of the vaccinations in that very first tranche went to firefighters, police officers, and others, many of whom don't live in the county. So that's why some of our initial vaccines went out to people who didn't live here. But we also provided 423 vaccinations to residents 75 and older. And of those, 68% were Prince Georgians, and there were 134 vaccinations provided to non-county seniors from this group. Let me say it once again, because I think it's important to clear up the misinformation. In that first tranche, there were not hundreds of thousands of people who didn't live here who received our vaccination. In other words, I kept hearing, oh, the people from Montgomery County, hundreds and thousands of them came here and received it. You should know there were 134 from other jurisdictions who received the vaccination. And we corrected course because we thought this was not equitable. So of the non-county residents to receive the vaccine, we went ahead and made sure that we restricted it as soon as we found out that this was happening. We restricted it and made sure that those who did not live or work in Prince George's County did not receive it here. And so we canceled thousands of appointments made by ineligible residents. And since that time, we have not made appointments for individuals who do not live or work in Prince George's County. And as I mentioned, we're turning away anyone who shows up at our vaccination sites who are not eligible to receive the vaccine. We believe that this is, of course, the equitable thing to do. Other jurisdictions are doing it as well. They are limiting their vaccinations to people who live and work in their jurisdiction. This is a limited, the vaccines are very, very limited, and out of pure fairness, this is the way that we're doing it. So I've received this question many times over the last few weeks, and I wanted to make sure that our residents understood that we are not giving doses of the COVID-19 vaccine to non-residents while Prince Georgians are waiting for their first dose. This is not happening. This is not happening. So I wanted to clarify that. And another thing that I heard that I also think is important for you to know is that I heard that there was a lot of concern about us allowing young people who are not eligible to cut the line in front of our seniors. Again, at our county health department sites, we're turning away anyone who shows up that is not eligible. And you must prove that you're eligible by showing proof of residency or employment. And there's no line cutting, and we're ensuring that the limited amount of vaccines we're receiving are being used to vaccinate our most vulnerable residents and workers. And so we're working every day to ensure that more Prince Georgians are protected from COVID-19. You know, this is an ongoing learning process, and we will continue to ensure that our county health department has the tools, systems, and processes in place to efficiently deliver the COVID-19 vaccine. It is so important that we continue to expand capacity now, even though vaccine supply is limited, because by working ahead, we are positioning ourselves to quickly administer the vaccine to hundreds of thousands of residents once more doses become available. I appreciate so much the engagement and the concern of our county residents. I want you to know that I hear you. As always, I am listening to you, and I am working hard every single day to alleviate your concerns. We didn't promise, nor could we, that we wouldn't have any challenges in rolling out this vaccination process. It is a first-time event for all of us, but what you should know is that we are working hard every day to get it right, that we are going to always, at every turn, as I have always told you, be transparent with you, to be honest with you about when things don't go well, and we will do our level best to correct whatever problems we discover. And so, while it may not seem like it, we are still at the very beginning phases of a process that will take us many months, but we will be prepared to move quickly as our vaccine supply increases. And I want to thank everyone on this call for tuning in today. I want to thank Prince Georgians. You have been absolutely beautiful in all of this. I know this has been distressing. I know it has been aggravating and frustrating, and you have made many, many sacrifices over and over again. And I want you to know how much I appreciate every sacrifice you have made. We're doing this for each other, getting vaccinated so that our loved ones will be safe, so that our neighbors and friends and family members will be safe. You are continuing, please, to wear your mask, to practice social distancing, to avoid unnecessary travel, to be careful so that together as a community we can make it through COVID-19. I have promised you that it will not have the final say. We certainly will make it to the other side of this, but I just thank you so much for your engagement. Thank you for working with us together to make sure that we make it through this safely and that our families do as well. So thank you so much again, and I will hand this back over to you, David.
Thank you, Madam County Executive. Thank you so much. And to the over 40,000 Prince Georgians that are on the line right now, thank you for joining. I know that a lot of you joined as the county executive was speaking. I just want to go over some housekeeping. You're going to receive by a text message, if you got the call inviting you to this call, a text message with the audio from today's Tele-Town Hall, which will allow you to listen in full to the county executive's remarks. That will go to your cell phone. Also, the audio from today's call, as soon as it's available, will be shared from the county executive's Facebook and Twitter accounts, at CEX Alsobrooks. That's at CEX Alsobrooks. And also, just to make sure that you know about our resources, our vaccine website is very, very helpful. You can find it at mypdc.us/COVID vaccine. That's mypdc.us/COVID vaccine. If you Google Prince George's County vaccine, it'll be the first thing that pops up. And if you are someone who does not have internet access, we encourage you to call 311 for questions. And also on that Prince George's County vaccine website, you can pre-register there. If you don't have internet access, you can call 311 and they will help you with pre-registration. All right, I'm going to turn it over to our newly minted County Council Chair, Calvin Hawkins, who has always been committed to our community. A lot of you are very familiar with him. He chairs the County Council made up of 11 members who fiercely are committed to your neighborhoods and communities. The County Council and County Executive try and work very diligently in partnership on your behalf every day. County Council Chair, I'll turn it over to you.
Thank you, David. Thank you, County Executive Alsobrooks, for this invitation on behalf of the County Council. County Executive Alsobrooks, we are so grateful for your awesome leadership in leading the county's response to the COVID-19 pandemic. On behalf of my colleagues on the County Council and following the leadership, partnership, and collaboration that you, Madam County Executive, and former County Council Chair Todd Turner commenced last year at the onset of when the COVID-19 virus hit Prince George's County. The County Council remains committed to working with you, your team, and all Prince Georgians to ensure that we get out the most accurate information surrounding the county's efforts to administer vaccinations to every one of our citizens as safely and prudently as practical. County Alsobrooks, thank you again for the invitation to participate on behalf of the Prince George's County Council. I'm looking forward to listening and participating in this very important conversation this morning. Again, thank you.
Thank you, County Council Chair Calvin Hawkins. Okay, so we're going to move into Q&A. There are some questions here that I know will reinforce what you heard in the County Executive's remarks, and we're going to jump right into it. I'm going to start in the category of vulnerable populations and under-resourced populations. And I'm going to direct this first question to Director of Community Relations, Unisha Davis. There are a lot of homebound seniors and people who have difficulty accessing transportation or have other barriers to getting to vaccination sites. What are you doing to reach people who can't get to vaccine sites? Can you bring the vaccine to them rather than them going to sites around the county? Director Davis?
Yes, thank you, David. Good morning, everyone. We are very concerned about our seniors and those who have a more challenging time of getting to our vaccination centers. As our CEX has stated, the supply is limited, and while we wait for an increase in supply, we are actively planning to mobilize in the community by using the mobile van unit. The Office of Community Relations will host in-person pre-registration events at 55-plus communities and also pop-up vaccination events at faith-based facilities in other parts of the county, and also in conjunction with our Stand Up and Deliver program. We know that some of our residents do not have access to computers, and we understand that that is a challenge. And so if you are experiencing that, you may come to the in-person pre-registration events or simply call 311, press pound, and you will be able to be assisted with pre-registration. And at any of our in-person events, we will do this in the safest manner possible while continuing to practice social distancing and, of course, having masks. So, again, look out for the pre-registration events that will be in person in your community, and we will make sure that information gets out to you this week. We have one coming up this week between Tuesday and Thursday. Thank you.
Thank you, Director Davis, so much. Next question to Dr. Carter. If I am undocumented, can I get the vaccine?
Thank you, David. And the answer to that is absolutely yes. You can definitely get the vaccine. The county does not and will not ask about your immigration status. All we want to do is get you vaccinated.
Thank you, sir. Next question directed to Director Gill. Director, I am a senior in Phase 1C with medical conditions. I have been on the waiting list for weeks. Why haven't I received an appointment? Have you forgotten about me?
Thank you, David. We understand your frustration and concern. You have done exactly what we've asked you to do, and you still don't have an appointment. Well, we finally have a solution. As you heard the county executive say, those on our pre-registration list who have been waiting will soon receive both first and second dose appointments. We assure you that it's our priority to vaccinate each and every eligible Prince Georgian that wants to receive the vaccine. But please remember that our ability to move through each phase of the vaccination plan depends on the amount of vaccine we receive from the state. We ask for your continued patience as we navigate through this phase of the pandemic.
Thank you, Dr. Gill. So I want to go to one of our residents that's on the line, Ms. Reagan Fitzgerald. Why don't you unmute yourself and ask your question?
Good morning. Thank you so much. And good morning, County Executive Alsobrooks, Chair Hawkins, and county officials. My name is Reagan Fitzgerald. I grew up in Bowie and moved back a couple of years ago. I want to thank you and the Prince George's County Health Department for your work during the pandemic. My mother, who is in Tier 1B and also lives in Bowie, received her second dose at the Sports and Learning Complex yesterday. My question is about the number of vaccine doses that the county has received from the state. Last week, Governor Hogan's spokesman posted a document on Twitter that showed that the county health department has received the same number of doses as Howard County, which has a much smaller population, and less doses than Baltimore County and Anne Arundel County, which are also smaller. The total was less than half of Montgomery County's allocation. We know that only 4.5% of our county is vaccinated, the smallest of any county in the state. And the Six Flags site, as you said, County Executive, shouldn't be factored into this because it's open to the entire state. How are you working with the state and the governor's office to get more vaccine for the county and alleviate this disparity?
This is Dr. Carter. Thank you for that question. Ultimately, the county has no control over how much vaccine the state allocates to us. They only tell us the minimum number of what we will get on a weekly basis. And the number is, as the county executive said, 975 is not enough. Sometimes we receive more than that. And as the county executive said, they have promised to increase that number. Once we get notice of our allocation, we kick into high gear, we start planning, we do scheduling for appointments, we do what we have to do. We are in regular contact with the state and we're communicating with them about the needs of our concerns. Ultimately, we know the state and everyone else is on the same page and trying to get to the same goal. We're pressing at all times to get to our fair share. So I appreciate that question, and I'll just let you know we're going to make sure that we get our fair share.
And Dr. Carter, I want to add to that too. This is the county executive. Thank you so much, Reagan, for the question. And I'm going to piggyback what Dr. Carter said in terms of us continuing to communicate with the state regarding our needs. We also joined a letter with several other counties asking the state for more transparency to tell us on a weekly basis how much we will receive and to be equitable in the way that they distribute that vaccine. As a result of that communication, as I indicated to you, we did get yesterday a response saying that we would have an increased number of vaccines that come to the county now. We can look for up to 4,200 per week. and we will continue to make sure that. But let me just say this, to just go straight to the heart of the matter. The point of the matter is this. It is not equitable for Prince George's County to have received less vaccine than other jurisdictions. There's absolutely no excuse for it, because the fact is the vaccines that we received are paid for by taxpayer money. The dollars that are used for these vaccines are taxpayer dollars. And so Prince George's County wants to make sure that we receive every single vaccine that we are entitled to. And if it is the case that for some reason we are not administering them quickly enough, we now have ramped up so that we have the infrastructure to get those vaccines in people's arms. But we'll continue to make the case at whatever levels we need to, that Prince George's County deserves to receive every single vaccine that should come here based on population. And again, nobody's doing us any favors. I want to be clear about that. Nobody's doing us any favors by providing us a portion of vaccines, because we paid for it. The vaccines are paid for by your dollars, your tax dollars, and it should be done by population, not by any other measure, because we are entitled to the amount of vaccines based on population and based on the fact that all of these vaccines are not paid for by any particular individual, they're paid for by all of our taxpayer dollars. So we're going to continue to press the message. And we'll be working, because that's what we do. We work with anybody we need to, with the state. We're working with the federal government. I want you to know that I am out there. We're sending letters, calling, and we'll make sure that we continue to get as much as we need. And your advocacy is helpful as well. But it's important that you understand exactly what Reagan just outlined here, is that we did not receive the amount of vaccine that was equitable. And we're looking forward to having that corrected going forward. And we will do our part in making sure that as the vaccine comes here, we can get it in those arms quickly. So thank you so much for the question.
Thank you, Reagan. Thank you, County Executive and Dr. Carter. Now I'm going to try to go to Veronica Carroll, who's on the line. Veronica, you should be unmuted. Please ask your question.
Yes, good morning. Good morning. I'm a resident in Prince George's County. I live in the Lanham area, and my question is regarding for my elderly father who lives in Glen Arden, Maryland. My dad is a 90-year-old and wants to receive the COVID vaccine. I have tried to register him, but unfortunately, I couldn't find any appointments. If it wasn't for me registering my dad on various outlets, he wouldn't have a chance because he's not computer savvy. There has to be a better way for the elderly to be registered. On one website that I registered him on for the state, I believe it was, and they wanted the elderly to upload their insurance cards. And I have issues doing that sometimes. So how could anyone expect the elderly to do that? So I'm just requesting that a better way be found to assist the elderly. Now, I must say, ending my question, last night I did receive a email for him. He has an appointment for Monday at the Reed Temple location. And I am truly, we're blessed for that. But there are other elderlies that I have been speaking to. They don't even have a computer. So how can we assist them? Thank you.
Thank you, Veronica. Dr. Carter, Dr. Davis, do you want to take the question?
Sure. Yes. And we do understand, again, the challenges that technology prevents for many of our seniors. And so we have 311. And with that, you dial 311, you press pound. We have a full COVID-19 response unit, and it is a vaccination registration unit. And we are here to assist our seniors in pre-registration and also with soon with scheduling for their first dose and second dose appointment. We do understand the challenge with uploading the various documents that are being requested. And so again, any senior who needs assistance may dial 311, press pound, and you will be directly taken to the COVID-19 response unit for assistance.
Okay.
And this is Dr. Carter. I want everybody to understand that the state system that the local health departments are using, that we're going away from, was designed for school and childhood immunizations. This system was not designed for mass vaccination appointments. And so we've had a lot of technical challenges and logistical challenges, and it definitely was not designed for elderly people. And our seniors are having difficulty. So as you know, I'm just going to reiterate to call 311 and press pound, and somebody will assist you. In the meantime, because of these challenges that we have with the state system, as Madam County Exec said, the county is implementing changes so that we can make this process much better, and we believe this will improve the situation.
Okay. Thank you.
You're welcome.
You're welcome, man. And, Director Davis, I know that your office is getting ready to activate some engagement activities around registration. Do you want to go ahead and talk through that?
Yes, David, thank you. And we will have our first pre-registration event at Cameron Grove Adult Resort on Tuesday from 1 to 3 p.m. So again, that's a pre-registration event. We will be sending out the information so that those who need to pre-register will be able to do so. So that's just the first event for this week, and we'll have another one on the 19th. So we'll have events coming throughout the next month and moving forward to help those who need assistance. Thanks, David.
Thank you. So I want to move to the area of vaccine hesitancy. We have a question from Mr. David Owens.
Thanks very much. As you mentioned, my question relates to vaccine side effects. Specifically, I've heard that some folks who received the vaccine have been going into cardiac arrest and dying. Is that true? And have there been any deaths reported from either vaccine?
Thank you, David. Dr. Carter?
Yes, this is Dr. Carter. I want to be sure everybody understands this. To date, there has been no serious long-term side effects or deaths associated with these vaccines. We closely monitor that. Everybody in the country does. And if that should occur, the health departments and the federal government will be the first to let folks know. But to date, the answer is no.
Thank you, sir. Our next question, I'm going to kick it back to you, Dr. Carter, was pre-submitted. Should you take the vaccine if you have allergies, for example, a shellfish allergy?
Thank you, David. So if you have a history of having a severe allergic reaction to vaccines or the components in the vaccine, you should check with your doctor and talk to your doctor about getting vaccinated. However, though, if you have a history of like shellfish allergy or other allergies such as that, which is not related to an injection that you have, not the ingredients in the injection, then you should go ahead and get the vaccine. If you're concerned about your allergic reaction, consult your doctor.
Thank you, Dr. Carter. The next and final area of questions is going to be in the area of logistics and customer service experience. I'm going to start with a question for the county executive. You addressed this a little bit in your remarks, but I know that we have people join late, so it is definitely worth bringing up again. After receiving your first dose of the vaccine, how do you schedule an appointment for your second dose?
Okay, thank you, David, for that. So what we mentioned a little earlier is that many people, there were a couple of problems associated with getting the second appointment using the state's PrepMod site. And as I indicated, one of the challenges that we found with the second appointment was that we were providing a piece of paper that had a QR code on it for people to go and schedule their second appointments. And unfortunately, we had a number of our residents who shared that information with family, friends, neighbors, etc. And those individuals went onto that site and took all of the appointments that were designated for people to get their second doses. And so that caused people who went to that site to be unable to get those appointments. So what we're doing going forward, we're changing a couple of things. One is that we are now moving away from the state scheduling site, because we have had so many challenges, and it's not just us. I mean, this is happening all across the state and other counties as well. As at the state site, as you heard Dr. Carter say, it's just extremely difficult to navigate, and you also heard one of our callers say it's just not intended for senior residents. So we're moving now into the county health department scheduling system, and so now going forward, one of the things that will happen is when you receive an appointment for your first appointment, your first shot, you will also receive an appointment simultaneously for your second dose. So we're taking all the guesswork out of it. You will receive the appointment giving you the time, date, and location of your first shot, and will also simultaneously receive that information for your second shot. So that's what you will see coming up in this next week as we begin to send out those appointments.
Thank you, ma'am. Dr. Carter, this next one is for you. Once the health department gives me a date and time for my appointment, is there anything else I can expect?
Well, once you receive your appointment information, I want you to start to prepare to present when you come your personal ID or your employment ID at the appointment. That's what you really need. That's all we need. And then please show that appointment. Just be sure you show up to your appointment about 10 minutes before, because I don't want you out there waiting too long. You have an appointment, so we're ready for you when you come 10 minutes before, and we're ready for you.
Thank you, Dr. Carter. And our final question as we approach the end of the hour, we're going to direct to Director Gill. Once I arrive on site for my appointment, what should I expect then in terms of instruction?
Thank you, David. When you arrive for your appointment and enter the facility, you'll first be required to receive a temperature check. Please remember to wear your mask prior to entering each of our facilities and to maintain social distancing. If you require assistance to get to the entry or to the entrance from the parking lot, please inform our attendants in the parking lot, and they will be happy to transport you down. If you're, our seniors residents, as long as those who have any condition that would prevent them from walking, our transportation team will gladly bring you to the front door. We ask everyone to remain in your vehicle, as Dr. Carter said, 10 minutes to your appointment. Once inside, you'll be checked in and allowed to wait in an area designated specifically for those who require assistance. At the registration desk, you'll be asked to provide your name and proof of county residency and or employment. You will then be escorted to the waiting area. When it's time for you to receive your vaccine, your vaccinator will review the information you provided at registration and explain the process to you. After you receive your vaccine, you will be required to remain on site for 15 minutes for observation per CDC guidelines. Please take this time to review your follow-up care instructions. You will also be required to schedule your appointment for your second dose of the vaccine on site. As County Executive Alsobrooks mentioned, moving forward, we will utilize a more functional, user-friendly site for scheduling those appointments. Thanks, Dave.
Thank you, Director Gill. So I'm getting ready to turn it back over to the county executive to close this out, but I want to thank the over 46,000 Prince Georgians who took time this snowy morning to get on this call with us and to hear the latest updates about our deployment program. One more time for housekeeping, because there's a lot of information that was given out. Starting with the question and answer, we tried to do our best in the hour to select pre-registered questions and get folks on the phone that represented the questions that we had been hearing throughout the last month from folks all across the county. But we realized we couldn't get to everyone's questions. That's impossible. So please utilize the vaccine update email address that I gave out earlier if you have a question that you feel like was not answered. That's vaccineupdates@co.pg.md.us. That's vaccineupdates@co.pg.md.us. Our COVID vaccine landing page, you can find it at mypgc.us, mypgc.us/COVID vaccine. That's mypgc.us/COVID vaccine. You can get all the latest information on our vaccine deployment program, who's in what phase, and that's the page that you need to go to pre-register if you have the internet. If you do not have internet access, please call 311, or if you know someone who doesn't have internet access, please encourage them to call 311. Director Davis and the team there do a phenomenal job at making sure they get folks on the call as quickly as possible, and there are bilingual operators there to help you if you are not an English speaker as your first language. Also, we're all still in the midst of the pandemic, so we are still, encouraging donations and volunteerism, and if you want to help out in that way, you can email us at COVID-19-relief@co.pg.nd.us, and that's COVID-relief@co.pg.nd.us. And if you want to follow us on social media, please follow at CEX Alsobrooks. That's at CEX Alsobrooks on Facebook or Twitter. So thank you so much. And now I'd like to turn it back over to the county executive.
Okay, thank you so much, David, and I want to thank everyone else. Chair Hawkins, thank you for being with us this morning and for addressing our residents, and thank also the entire team. And thank each of you, to all of our Prince Georgians, thank you so much for joining us this morning. 46,000 of you woke up and became engaged in this conversation, and we thank you so much, as always, for your engagement. We thank you so much for how you have made sacrifices during this time. And what I want you to know is that we are working around the clock to make sure that we're doing our level best to provide everything that you will need to get through this period. The vaccination process will continue to be transparent about it. We'll continue to improve it every day. And we're going to work to diligently get Prince Georgians vaccinated and to help all of us be protected to get to the other side of this. So I thank you for working with us. As David has said, this call doesn't end our engagement with each other. All of the various ways that you can continue to call us if you need us, from 311 to the web page. Don't hesitate to reach out with your issues and concerns and questions. We are here to serve you, and we thank you so much again for being on the call today, and we look forward to getting all of you and your families vaccinated and look forward to getting to the other side of this pandemic together. So thank you so much again. You all please continue to stay safe, wear your mask, social distance, do all of the things that you have heard all along, and to be safe. Thank you so much. God bless you, and have a great day.